Hi, my name is Amanda Robert,
And I am Vivian Tochi.
and we are the clinical dietitians at Jupiter Medical Center. We are here today to talk about breast cancer and nutrition, in specific prevention. It is estimated that 50% of women diagnosed with breast cancer have identifiable risk factors besides age and gender. Certain hormonal reproductive factors, as well as certain lifestyle, diet, and environmental factors, are associated with increased breast cancer risk. Even in women with a high genetic risk for breast cancer, nutrition factors such as body weight and diet are powerful tools for reducing risk, and these factors are all within your control. Some of the basic elements that we are here to discuss with you are: one is to achieve a healthy weight. You want to try to keep your weight as consistent as possible. It is a very high risk if you are fluctuating, trying all different diets, trying to get your weight up or down. We need to really maintain a consistent weight where you feel healthy. The next thing is to exercise regularly. We usually recommend 150 minutes per week. That adds up to 30 minutes 5 days a week, or 20 minutes 7 days a week. The next thing is, as everybody knows, is we need to lower our dietary fat, or to at least 10 to 20% of our overall calories. Some ways to do that are limiting your saturated or trans fats. That includes salad dressing, butter, things like that, as well as limiting our red meat. Usually I recommend about 2 to 3 days a week, but watching our portion size of about 3 ounces at a time. In that sense, you would also want to include more plant-based or soy-based foods, beans, and once again, soy. Some of the other things to try, including fish, some of the very high, the ones that you really would like to include are salmon, tuna, mackerel, or herring. You want to try to have about 6 servings of grains per day. Whole grains preferably that have more fiber, so all your brown rices, brown pastas, brown breads. There is some research on flaxseed. However, the research has been done on animals, and there's not been a lot done on humans. So really, it will not hurt you to have it. Just make sure you ground the seeds in whatever recipe or however you're using it. The next, as everybody knows, is fruits and vegetables. Vegetables being up to 3 to 5 servings per day. You want to stick with ones that are very dark green and leafy, or cruciferous vegetables. Some of these are spinach, kale, cabbage, collard greens, romaine lettuce. And another vegetable that we may not think is a vegetable is garlic. That is a very important ingredient in a lot of things. So if you're going to cook, you want to try to use the fresh garlic in seasoning a lot of your foods. Fruits, you want to stick with 2 to 4 servings of fruits a day. They are natural sugar, and Vivian will talk about sugar a little later. Some of the types of fruits are the orange and yellow type fruits, oranges, grapefruit. They are more your yellow and orange fruits. Some of the other fruits are apples, grapes, berries. They all have specific antioxidants, and there are too many to mention that you want to try to get in your diet every day. The next and last is beans and soy. I've combined them. Beans are things like lentils and peas. You want at least 1 to 2 servings of those a day, especially when you're limiting your red meat. And the next is soy, which is one of those controversial topics. However, as long as you stick to 1 to 2 servings of whole soy foods and not your supplemental or powdered versions, for example, soy milk, soybeans, or soy nuts, that is a very positive thing to include in your diet.
I'd like to now continue with some other key points in breast cancer prevention. I'd like to talk about sugar. Now, sugar is refined, and it is found basically in your cakes and cookies, pies, regular sodas, candies. And what really is the issue here is when you eat too much sugar, your blood insulin levels increase, and it's this elevated insulin in your blood that actually increases the risk of breast cancer. So how much is too much sugar? We are recommending less than 6 teaspoons of sugar per day. And to put that into perspective, 1 can or 12-ounce can of Coca-Cola contains 10 teaspoons of sugar. So you see how quickly that adds up. Now remember that the natural sugar in fruit is fine and it is not associated with any breast cancer risk. So as Amanda talked about the fruits, you definitely want to include those in your diet. The next topic we're going to talk about is alcohol. Now, there has been clearly a link shown between increased alcohol consumption and breast cancer risk. And it goes without saying that the more you drink, the higher the risk. The newest research is rather interesting in that it is talking about women who start drinking before they become mothers. So we're talking about before they have their first full-term pregnancy. It shows that actually even one alcoholic drink per day can increase the breast cancer risk by 13%. So regardless of age, women are recommended to drink no more than one alcoholic drink per day or not at all. And what does one drink mean? Well, it's 12 ounces of beer, which equals the alcohol content of 5 ounces of wine or 1.5 ounces of alcohol. The next topic is caffeine. Where do you find caffeine? Obviously, it is in coffee, tea, and the cola drinks, as well as in smaller amounts in chocolate. Now, in the past, there have been some studies that linked caffeine intake with breast cancer risk, but in the newer studies, there really is no relationship at all. So I would say go ahead and enjoy that cup of coffee or tea. Again, remember, moderation is always recommended. So I would say let's go with only 2 cups or less of a caffeinated beverage per day. The next topic are the food additives, pesticides, preservatives, and there are some compounds in our environment that have estrogen-like properties. And these would be mostly found in plastics, some personal care products, that type of thing. And, you know, there's always been a lot of interest and talk about, you know, chemicals in our environment and what's in our food. But the research really does not show that there is a link between these substances and increased breast cancer risk. The going trend is to eat more organic. It can become very expensive. Would we like to all go organic? Probably, but the bottom line is you really want to try and buy foods that are, you know, the fruits, the vegetables, the whole grains, the poultry or fish, things that you would cook from scratch and things that are not prepackaged or processed. So, you know, I think that it's more important that you actually get the fruits and vegetables and whole grains in your diet rather than being concerned about where they are actually grown. The last topic is smoking. There is nothing good that I can possibly say about smoking. Mm-hmm. It is something that has been linked with breast cancer risk. And obviously, the more you smoke and when you start at a younger age, the more risk there is for developing breast cancer. So to kind of recap everything that Amanda and I talked about, number one, you want to try and achieve or maintain a healthy weight. You want to be physically active every day. You want to limit your amount of dietary fat and meat consumption. You also want to consume at least 3 to 5 fruits and vegetables per day. Include also the whole grains and legumes. Limit sugar, alcohol in moderation, if at all, and don't smoke. And remember that eating healthy is a gift to yourself. Enjoy.